Hi, my name is Dr. Robert Gilliland. For those of you who are unfamiliar with my story, I was diagnosed with ulcerative colitis 28 years ago. 7 years later, my doctor changed my diagnosis to ulcerative colitis. Now, the three things that my doctor told me that really stuck out is, we don't know what causes it, there's no cure for it, and the only option that I had was to take medication for the rest of my life to treat the symptoms. Now, I wasn't happy with this prognosis, so I had a second, third, fourth, even a fifth opinion. But every medical doctor or specialist that I spoke to gave me the same advice. So, acting on the best information that I had at the time, I took the medication. At first, everything seemed okay. All my symptoms of my disease vanished. I thought, this isn't so bad. But within a couple of weeks, my face swelled up, I broke out all over my back and chest, had terrible indigestion, and I had uncontrollable mood swings. I wasn't happy with the side effects, but it was still better than the symptoms of my disease. When the side effects finally did go away, I had another flare-up about 6 months later. Now this time it took more drugs and more time. And as time went on, this became my pattern. The time between flare-ups became shorter and shorter, and more medication was needed to get me back into remission. Now, I went through a 3-year period whether I was living either with the symptoms of my disease or the side effects of the medication. Now, I had seen medical doctors, specialists, and alternative doctors, but no one seemed to be able to give me the answers I was looking for. So, I decided to find the answers for myself. I began a 25-year journey searching for answers. I started out in traditional medicine. I enrolled in school, learned everything I could about anatomy, physiology, pathology, and nutrition. I even got a job at the hospital, which gave me an opportunity to talk with all the different doctors there. But still, the only answer that I got was to continue taking the drugs. The problem was that the drugs weren't working. And my doctor started talking about surgery. He told me that with ulcerative colitis, surgery was curative. Now that sounds like good news, doesn't it? But the cure meant that I would have to have a colostomy bag. Now that's not my idea of a cure. So after 2.5 years working in a hospital, looking for answers in traditional medicine, I finally gave up on the possibility that I would find answers there. Next, I enrolled in chiropractic school. Now, I didn't expect chiropractic adjustments or physical therapy to fix my problem, but chiropractic license would give me more tools to work with, because the only limitations I had using that as my license is that I wouldn't be able to give drugs or perform surgery. And I'd already given up on that idea anyway. So it seemed like a perfect fit. I learned a lot about how to treat the body naturally, using different natural therapies, including diet and supplements. However, after 4 years, I still didn't have the answer that I was looking for. But I didn't give up. I continued searching for an answer. I wasn't going to let this disease get the best of me. I kept doing research, flying across country to different seminars, going to people who said they had the answer, only to be disappointed. Finally, I discovered functional medicine. Now, for those of you who don't know, functional medicine is a combination of both traditional medicine and alternative medicine. It uses the diagnostics from the medical side and the all-natural therapies from the alternative side. It basically marries the two healthcare disciplines that I had studied. The big difference between functional medicine and traditional medicine is how they search for answers. Now, in traditional medicine, they run just enough tests to determine if you have a disease and then how to treat you, which medication do you need. In functional medicine, we look for the underlying cause of your problem. Therefore, we have to do more testing and use different tests and specialized tests to look for the underlying cause of your problem, which was what I was looking for from the very beginning. I wanted to know what caused it So it would give me an opportunity to actually do something about it and not just take drugs to cover up my symptoms. So I took the necessary classes. I took nutrition, neurology, functional endocrinology, and functional blood chemistry analysis, to name a few. Because here's the thing, if you're going to handle these tough chronic conditions, you have to know how the different organs, systems, and glands affect one another. Otherwise, you'll not have success treating these difficult chronic conditions, because everything in your body affects every other thing in your body. You can't compartmentalize things. You have to be able to step back and look at the person as a whole. You can't treat the disease. That's not going to work. You have to look for the underlying cause of the problem. And even sometimes that's not enough. You have to also correct things in a certain order. Because if you skip a step, you're not going to be successful. If you go after Crohn's disease, ulcerative colitis, or irritable bowel syndrome without first correcting underlying problems such as blood sugar problems, anemia, gut dysbiosis, or leaky gut, or adrenal malfunctions, you're just spinning your wheels. These are the roadblocks that you must first address before moving forward. Now, the first step in my program is ordering thorough blood work. Now, I'm not talking about running the spot checks that your other doctors run. I'm talking about running the tests that you need to run in order to find out if you have any of these roadblocks, blood sugar problems or anemias or gut dysbiosis or leaky gut or a maladaptive adrenal gland. The blood work includes lipid panel, complete metabolic panel, a thyroid panel, a CBC with differential. You need to look for infections. Now, a CBC with differential breaks down the white blood cells so that you can see if you're dealing with something that's more likely viral or bacterial. You could also be dealing with parasites or other infections. Now, we also need to see how much inflammation your body has. We need to run a couple of tests for that. We check your homocysteine levels and your C-reactive protein levels. Now, another important thing to check is your vitamin D levels. Vitamin D is actually a hormone that helps regulate or modulate your immune system. If you have low vitamin D levels, which most of the people in this country do, it's going to be almost impossible to calm down your immune system. Now, this is just the first step. We need to address these things before moving forward. Now, typically, this is going to take 30 days. Step 2 is running the test that we need to run in order to find out what's causing your immune system to go on the attack. These are the specialized tests that your medical doctor or gastroenterologist probably don't even know about. Now, because they're just not trained, that's not how they're trained in school. It's not a part of their protocol. You have to understand that your medical doctor sees things in either health or disease. And I'm not saying it's their fault. That's just how they were trained. They're not looking for the underlying cause of your problem. Now, medical doctors are smart and caring, but they don't know what they don't know. Just as I didn't know when I went through traditional medicine or alternative medicine. Sometimes when you're looking for answers, you have to be able to look outside the box. Sometimes customary is not enough. Continuing on with step 2, once we find the thing that's actually causing your immune system to go on the attack, you must eliminate it. If you do not, there's no drug, no vitamin, or supplement that's going to be powerful enough to give you more than temporary relief. That's something you have to do. If you're not willing to do that, you're not going to get the benefits. I let all my patients know from the very beginning that they have to take responsibility for their own health. Now, this means acting on the information that I give them. If you do not act on this information, you will not get well. It's that simple. Now, the third step of this program is using the correct vitamins, minerals, and supplements to calm down your immune system. Now, there are two parts to your immune system. There's Th1 and Th2. One is B cell mediated. Now, this is the part of your immune system that makes antibodies against antigens, so they'll know when they come in contact with them again whether they're friend or foe. These are the things that your body sees as invaders. When you have an autoimmune disease, it means that your command system gets confused. Your immune system gets confused and mistakes your body's tissue for invaders or antigens. This typically happens when you develop a leaky gut and things can get into your system that wouldn't normally be able to get into your system. Now, your gut lining is much like your skin. The outside layer of your skin protects you from invaders. But if you get a cut or you get a burn, things that your skin was protecting, keeping on the outside, can now get on the inside. And the thing that you have to worry about when you break the integrity of your skin is infections. And it's the same way with your gut lining is your second skin. The problem is that most of the proteins that get tagged are very similar in appearance to your own body's tissue. You got to keep in mind that you're looking at these things on a microscopic level. Even things that look very different to the naked eye look the same when you look at them through a microscope. And if you've ever looked through a microscope and really zoomed in, the one thing that you're looking at, you have an idea of what I'm talking about, because you can, it looks different from one, from a 10x, and you go down to 100x, it looks totally different. And that's the way it looks to your immune system, because the proteins in something like wheat can look very similar in structure to the proteins in your thyroid tissue or your gut cells. And that your immune system sees that. It's been tagged by another part of your immune system, so it just attacks. It doesn't know to leave it alone. It's confused. And the only way you're going to stop it from attacking that is to avoid the things that it's mistaking it for. Meaning you take out the things that cause the immune system to attack in the first place, it's going to stop attacking your tissue. Now, the other part of your immune system is T cell mediated. Now, this is a part of your immune system that attacks foreign invaders and then cleans up afterwards. Typically, we find that people with Crohn's disease are Th1 dominant, and people with ulcerative colitis are Th2 dominant. Now, if you have irritable bowel syndrome, the reason that I'm not speaking a lot toward it is because it's not nearly as complicated. It's a lot easier to fix it. You need to run the same test to determine the cause because they have the same causes, but it's much quicker and easier to fix irritable bowel syndrome than it is to fix irritable bowel diseases. Now, your immune system is like a teeter-totter. You have to balance the two out. And this is as simple as supporting the non-dominant side until the teeter-totter is level. So basically, what we do is run the necessary tests to find the roadblocks so that we can correct it. And then we run specialized tests to determine the underlying cause of why your immune system is attacking. Then we balance out both sides of your immune system and calm down your immune system with all natural therapies such as vitamin D, glutathione, essential fatty acids, and whatever else we find that needs correcting. Now, this is what we do in our office. For me, this was life-changing care. It allowed me to be drug-free and symptom-free for almost 2 years now. Ever since I discovered and eliminated the underlying cause of my problem, and then calmed down my immune system with appropriate supplements, my life has been dramatically improved. Now, I can't guarantee the same results for you that I've had or for my other patients have had, but if it allows you to have more time in between flare-ups or less severity of your flare-ups, then it is much better than anything that you're currently doing now. Now, I only work with 25 patients at a time. I choose the patients that I work with carefully. If I don't think I can help you, I'm not going to accept you as a patient. And if I don't think that you're willing to do the things that are necessary to correct your problem, I'm not going to accept you as a patient. I do have a few rules as far as qualifying to be a patient. Number one, no smokers. You can't smoke because if you smoke, you're denying all the cells in your body of oxygen. You're depriving all these cells of oxygen, and you're not going to get well. Number two, you have to take responsibility for your own health. If you're unwilling to make lifestyle or dietary changes based on what we find in these tests, it's not going to do you any good. Because if you know that this is the thing that's causing your problem, but you don't act on that information, it doesn't really, it really doesn't do you any good to know what it is because you're not acting on it. You have to implement the things that we find. And number three, you have to be willing to pay out of pocket because these services are not covered by insurance. However, I do offer financing. If you finance the cost of this program, and it includes everything, doctor's fees, blood work, specialized tests, and supplements, everything, you can get this typically for around $200 a month. This is something almost anyone can afford to fit into their budget. Now, if you're unwilling to follow these three rules, I'm not going to accept you as a patient. I have spent too much time and effort searching for the answers to work with someone who isn't motivated enough or desperate enough to do whatever it takes to get well. If you would like to schedule a free consultation, you can call my office at 239-444-3106. Now, my office is located at 27499 Riverview Center Boulevard in Bonita Springs. Thank you for watching the video, and I hope to see you soon.